For 1 in 100 children in Texas, something as simple as riding a bike or sleeping on the top bunk bed might seem like an impossible dream. They live with epilepsy, a neurological disorder characterized by seizures, which makes everyday childhood activities feel dangerous or out of reach. And for about 20% of these children, the biggest challenge isn't just the seizures. It's getting the care they need. Here at Dell Children's Medical Center, that changes. The center is part of UT Health Austin Pediatric Neurosciences at Dell Children's, a partnership between Dell Children's Medical Center and the clinical practice of Dell Medical School. The partnership, recognized among the nation's top programs by U.S. News and World Report, has recruited leading pediatric neurologists, neurosurgeons, and more to offer advanced care in Central Texas.
Epilepsy is a unique disorder, and that we know it affects more than just the moment in which a person is having a seizure.
That's Kristen Arredondo, a neurologist who specializes in complex epilepsy.
When patients come to see us at Dell Children's in our Epilepsy Center, what we're providing is the opportunity to see a whole slew of specialists and to determine what is best for their child. So we have the ability to offer you an appointment with a neurogeneticist. We have epilepsy-trained neurosurgeons. We have epileptologists such as myself and my colleagues who have spent many years training in how to diagnose epilepsy and best management strategies.
And they're just one part of the larger team it takes to care for a child with epilepsy.
The treatment of epilepsy can't be done alone. You need to be at a big center. You need to be at a place that can understand all the different dimensions of it. When it comes to the child, we as the providers talk to them directly, because this is who it's about. We have child life specialists that help explain things that may be lost on them from how providers may have explained to them. We have social workers that help navigate all the insurance approvals and getting him into this therapy and that therapy so parents don't have to deal with that kind of stress. We have neuropsychologists that address the school issues, that a child may have as a consequence of their epilepsy. The parents get connected to other parents to know that others are going through the same thing and how they've been cared for here at Dell Children. So our commitment is not just to the child, but to the whole family.
Here, care isn't fragmented or scattered across cities. Everything a child with epilepsy needs, from diagnosis to surgery, exists under one roof.
Here at Dell Children's, we provide the highest possible level of care in the country.
Dr. Clark serves as chief of the Pediatric Epilepsy program.
The onus of Dell Children's Level 4 Epilepsy Center is to help people around the region, around the state, and nationally, both through education, advocacy, and providing that clinical care.
So, what does that mean for families? It means expert-led care that's customized to each child's unique condition, needs, and story. It means specialists who talk to each other. It means fewer delays, and it means better outcomes. That improved care is exactly what drew families like the Hiltzes to Dell Children's, and it made all the difference.
We have a daughter named Charlotte Hiltz. She's now 5 years old. So she was diagnosed as just with having epilepsy. One day would be able to walk fine, and then the next day she'd have a limp. I remember being terrified because it felt like you were losing her.
And when we were pointed to Dr. Clark and he reviewed everything about Charlie, it just seemed very apparent that we were in the right place.
For the first time, I think, through everything, we finally felt heard. Dell Children's has the best team in the world, and they changed our lives.
But it's not just about having great doctors. It's also about our collaborative, team-based approach to treating epilepsy.
There really is no cookie-cutter approach to treating epilepsy. It truly is individualized, and we could not do what we do here in a silo with individual providers. We truly do use all the information gathered by all of our specialists to come up with the best possible recommendations for our patients.
This multidisciplinary collaborative model is what sets Dell Children's apart. And for families navigating epilepsy, it makes all the difference. The center is also home to the only dedicated Pediatric Epilepsy Monitoring Unit, or EMU, in Central Texas.
Many families come to us to the epilepsy monitoring unit not feeling sure about a diagnosis or an approach to care to help control their child's seizures. And what we're able to offer in our epilepsy monitoring unit is diagnostics so that we can have families understand their child's epilepsy better and feel empowered with a plan for care.
But the EMU is just one part of the story. When seizures can't be controlled with medication alone, Dell Children's offers some of the most advanced pediatric neurosurgery in the region.
The way neurosurgery treats epilepsy is twofold. One is to invasively investigate where seizure foci are coming from, and then doing the definitive treatment. There is a variety of different seizure surgery options, and we're able to use all of them here at Dell Children's.
With all the cutting-edge technology available here, our surgeons use tools like intraoperative MRI, robotic-assisted surgery, and advanced brain mapping to perform surgeries with the highest level of safety and precision. Beyond the operating room, care continues in our outpatient center.
So here at Dell Children's, we try and provide clinics and opportunities to meet just about every need within epilepsy. There's nothing like Dell Children's epilepsy program within Austin, Texas. We're finding different ways in using the technologies we have. If you place the patient of the center of what you do, technology will grow.
Ultimately, the mission is simple: to make sure every child in every corner of Texas has access to the best possible care. Whether that's through virtual consults, statewide partnerships, or new outreach initiatives, the goal is always the same: better outcomes, fewer seizures, more childhood.